Good morning, everyone. I am Ernesto Burden, the publisher of New Hampshire Business Review, and it's my pleasure to welcome you to today's webinar, Reimagining Health Benefits, New Ways Employers Are Managing Healthcare Costs. This webinar is sponsored by United Healthcare. So thank you to them for sponsoring, and thank you to you all for being here today. Our panelists today are Caitlin McCormick, Vice President Sales and Account Management for United Healthcare, and Bill Schreiber, an account executive at Surest. So let's jump right in with Caitlin. Welcome, Caitlin.
Thanks, Ernesto. It's great to see you.
Likewise.
Great to be with everyone this morning. Thanks to everyone for joining and taking the time to hear from us this morning about some ways that we're working for simpler, more affordable, and supportive care. If you are an employer on the line, or if you're a broker, or just in any way involved in the employee benefits arena, you understand the need, I'm sure, for these three components on the screen: care that is simple, care that is affordable, care that is supportive. And the benefits that you design for your employees or for the clients that you work with are so critical to the experience that they have when they approach the healthcare system. So as we start here, when you think about, what are the expectations of today's employers, providers, and most importantly, members, right? At the end of everything we all do every day is really the privilege to serve the members who rely on United Healthcare each and every day to provide them with health insurance that allows them to get the care that they need when they need it most. And so it really comes down to people expecting and deserving personalized experiences, on-demand support, and transparent pricing. I think that we as an industry have talked for years and years about transparent pricing, right? It was when we first rolled out HSA plans almost 20 years ago that we said, it's time for transparency in our industry. It's time for people to understand how much they're going to pay before they go to the doctor. And that all sounded very good in theory, right? And we all made great strides and great efforts to provide that level of transparency. But the fact of the matter is, people who interact with the healthcare system are not benefit professionals, and they should not have to be. We have to make it easier for that transparent pricing and that quality information to get into the hands in a really meaningful way for the members that we serve and for the employers that we have the privilege of working with. So what if employers were able to actually provide health benefits at a manageable cost? What if members could more easily understand their benefits and know what their expenses were going to be before they walked into a doctor's office, not through using some complicated app or website or making tons of phone calls, but what if it was really easy? What if their care was really connected? And what if the system actually helped rising chronic conditions and payment and quality metrics? What if all of those things work together? I'm excited to be here today to talk to you about what that might look like. As we go to the next page, you can see here, we are facing a fragmented system with rapidly rising costs, right? 54% of surveyed employees reported that they don't understand the full scope of what their health plan offers them. So if you're an employer, think about the fact that this is the second largest line item in your budget, most likely after payroll, providing these health benefits, and 54% of your employees don't understand what's offered to them. You're paying a lot of money for something that people don't know the value of because they can't understand it, and reasonably so. 1 in 5 U.S. adults have received an unexpected medical bill. If you think about average incomes, think about a family of 4 making $100,000 or $150,000 a year. Can they afford an unexpected medical bill? Probably not. And if they can, it might mean that they can't afford then to heat their house or pay for food or pay for childcare or go on vacation. Most Americans and most people living in New Hampshire as well do not have that extra income lying around to just pay a bill out of on a whim. 80% of health outcomes were impacted by things like unaddressed social determinants of health. And I think when we think about social determinants of health, we often think of it as a Medicaid issue, as an uninsured issue. but truly it's a commercial issue. We had a conference recently where we shared data that within our own book of business, within our New England health plan of commercial members, right, on employer sponsored plans, almost 40% of them are facing some sort of financial insecurity. Almost 20% of them were at risk of either a housing or food insecurity. Not meaning that they had a housing or food insecurity, but that one or two bills could put them there. So we need to help members who are in these financial situations, the financial situations that the average American is in, by giving them a plan that works for them and that predicts their costs with some level of certainty. As we move to the next page, think about the factors at play right now, right? We're coming out of the pandemic, one of the few things that was maybe good about COVID was it accelerated virtual health and it highlighted the need for people to get the behavioral health care that they need. It also highlighted the health equity concerns that I was just talking about and the need for health plans for employers, for all of us to share the responsibility of meeting people where they are at in that health equity spectrum and getting people the care that they deserve. And we can do a lot of these things through plan design. And that's what I'm really going to dive into here. I'm going to talk to you today, and you'll hear from our subject matter expert on this topic, Bill Schreiber, in a few minutes, about a program called Surest. So Surest is a new kind of health plan, although not that new. We've been at it for about 5 years in different places throughout over the course of the country, and we've been live in New Hampshire for just about a year now, a little bit over a year. And Surest proves time and time again to provide substantially lower cost. It is a plan that has no deductible or coinsurance. I'll pause there for a second. No deductible, no coinsurance. If you were to stop 4 people in the street and ask them, hey, do you know what a deductible is, what coinsurance is, what an out-of-pocket maximum is, and you had the definitions on the right side of the page, only 1 out of those 4 would be able to accurately draw the line to tell you what those definitions meant. Yet we ask people every single day, here's a $5,000 deductible. And, you go to the doctor and you figure out what it's going to cost and you pay out of pocket until you reach your deductible. And then we'll give you coinsurance and do that calculation. And that's next to impossible for the average American. So Surest is a plan that doesn't have any of that. It's straight copays. It's access to our broad national United Healthcare network. Members check their costs through an app and know exactly what they're going to pay based on where they're going. And they use an app that drives them to the most quality providers. For anyone on the phone, I know you can't really participate as an audience, but if I were to ask everyone on the phone, have you ever bought a TV off the 10th page of Amazon? It was Prime Day yesterday, right? So a lot of people are probably doing a lot of Amazon shopping. I would guarantee that no one on this phone has bought a TV off the 10th page of Amazon, right? Because you're not going to keep scrolling and go through all the higher rated TVs and decide to buy one 10 pages in. It's the same thing when you're shopping for healthcare. If we put the quality providers first and give you an incentive to see those quality providers, not the cheaper providers, but the quality providers that are going to give the best outcomes. If we list those first and give you a cost incentive to use them, most people, myself included, are going to use those providers. 72% of Surest members spent less than $500 out of pocket annually. Think about that. Think about a plan that right now might have a $5,000 deductible, and now you're going to spend less than $500. 80% reported fewer barriers to care, and this all was wrapped with 11% employer savings. So if you're sitting on this phone thinking, wow, this plan sounds great, but it sounds expensive, it's not. It's proven to provide sustainably lower costs year over year because of the way it works, and that's what we're going to show you today. We've seen a steady growth of Surest clients and members. It's the fastest growing health plan that we have across the country. Big name customers, we offer it to our own employees, Best Buy, Medtronic, Culligan, Lumen. You can see some of the logos here on this slide. Now, you might be thinking what I thought when I first saw the program, like, okay, for our young, well-educated, healthy employees, maybe they'll think about going to this plan that requires use of an app. If you look at Best Buy, for instance, the greatest uptake we saw with Surest participation right out the gate was with their distribution workers. Why? Because everyone has a smartphone. So if you're working in a distribution center and you're not in front of a computer every day, you're still looking at your phone and you're looking at it when you get home, right? Anywhere you go now, everyone has a smartphone. And so this is a way to get quality, affordable care at a lower price, and make it very simple for these employees to use. Again, this is not a special network. It's wrapped by United Healthcare's national network. Wherever you have employees, this plan is available. It is available in New Hampshire, both self-funded and fully insured. So regardless of what type of funding mechanism your plan has, you can have Surest. Going to the next slide. If you look at clients by industry, right, you might be thinking, well, am I in an industry where this works? You can really see that there's a big range of industries that have found success with Surest, and this continues to grow. By 1/1/25, we expect that 1 in 3 national accounts will be offering Surest as a plan option. And again, it doesn't have to be full replace. Sometimes it's an option alongside a more traditional plan. Let's say someone has an HSA plan now and they want to make sure that their high earners still have that savings vehicle. They might choose to still offer the HSA plan, but offer Surest alongside it as another option. As we go to the next slide.
Hey, Kaylin.
Perfect. I'm going to introduce Bill Schreiber and you can take it from here, Bill.
Yeah, let me just jump in. Why, maybe, again, are we seeing such rapid adoption of this option across the country? Why are we seeing such broad adoption across all industries? We go out and talk to our clients. What is it that you liked about Surest? What are your challenges? And so in every industry across all member ages and demographics, we're hearing consistent feedback. The current options that we have today just aren't working for everyone. It's about time we had something new. Caitlin alluded to this, but let me just revisit what exactly is not working. Again, people feel that their insurance and the healthcare system is namely confusing, complicated, and expensive. Confusion starts with what Caitlin mentioned is the language, the terms. People just don't understand deductible and co-insurance. Members feel the entire process is complicated, and trying to find a doctor navigating the increasingly challenging healthcare system is difficult, often ending up in the wrong places, seeing the wrong providers. All of this process is full of surprises, which always feel expensive. So what's the answer? Well, if you ask members what they think the answer is, the overwhelming view is that we should have a menu of options, we should have prices on things, and we should know before we go. The folks over at Gallup did a national survey here in the last year. What they found amongst Americans, we don't agree on much. Feels like we know that more and more in these times. But what we all agree on is that we ought to have prices. There ought to be transparency. We ought to know before we go. Certainty, no surprises. So Surest is the first new policy in the health insurance market. It's the first new option in 25 years. And it's aimed at doing just that, giving people prices. Here is how. As you can see in this sample to the right, we've taken co-insurance and deductible out of the plan. We do the math for people. We convert everything into copays. That's an insurance term for a price. And we've ensured that that copay covers a member's entire visit, so everything's included. So in the policy, there is no jargon, no math, no surprises. Everything has a price. It's a simple, straightforward, clear plan. And we have a menu for members to see before they go, which we know is what people want. So naturally, we see a tremendous amount of engagement. 80% of members are turning to Surest. They call the help desk, they jump on the tools to see their options before they go. Here's the big important step. We're turning that engagement into education. Our clients are looking for a way to make education easy. Help members find care that helps them get better faster, stay better longer. Find high value locations, treatments, and providers. And so you'll see an example of this here on the right in our lines of service. We simply lower the copay for high value care. For care member schedule, be it a procedure or an office visit, you can see that range to really affordable options. And we continue to hold a better benefit for emergency services. There's just a single copay for whichever urgent care or emergency room that you visit. And this is all, again, under a single out-of-pocket max without a deductible or coinsurance. We simply redesign the policy so employers can offer simple, straightforward option that people want. Members lean into the high value care options. This is creating savings for them. They're seeing about $500 a year in savings out of their pocket when they go for care in the hospital system. And because they're making choices where care costs less in total, it is bringing down the cost of the plan, lowering premiums for employers. I want to jump into the driver's seat of what it feels like for a member to use the plan. As a follow-up to today's conversation, we're going to give you the opportunity to do the same. You'll be able to jump into an HR learning hub we put together where you can find content about Surest and a demo for you to see yourself. Let's jump ahead then and show you what that demo looks like. Here we are. As a member on Surest, I can use my desktop, my mobile, I can call the help desk for my options. It is increasingly complicated to figure out where you go. You pick up your kid from school. Do I run to the emergency room? Is there a new urgent care that opened up on the way home? For members, we can help them figure this out in an easy fashion. Feels familiar, like shopping on Amazon or Google. There's that familiar search bar. Simply type in anything I have, need, or want, or my doctor, and I can see immediate results. Sinus infection is a good example of this. It's easy. One click away, I can see my options for care. I can go to the emergency room. Maybe that's something I'm familiar with doing and I've done in the past for convenience. But now I know that if I do, it's obvious what it'll cost me, simply $350. Better yet, is an urgent care option at $35. I can click in to see where those locations are, find one that's convenient on my way home from my kid's school or to the office. Better yet, we continue to remind members that there are even more affordable places to start, virtual care being one of them. And we remind them that that's a free $0 copay experience. If I want to see a provider in person, I can certainly go back to my PCP. I can find a new specialist, and I would click through the provider options and see a list of options here in the broader Manchester area. And we'll see those high value providers starting down the left-hand side of the page, in this case, for just $10. But I can be able to go wherever I'd like within the UHC network. I'll have to pay a little bit more for lower value care, but I can see transparently upfront what my options are. What we hear from members is care is full of surprises. So those copays cover your entire service. If your provider decides to do a lab or an x-ray while you're at the office, it's included in that copay. It's increasingly confusing when members go for major procedures. If you've ever had a major procedure, you know that there seemingly is a bunch of surprise bills after the fact. We make it clear, we make it simple. Members can search for an elective procedure, like a knee scope, if you will, and we can show them their options. They're able to have that procedure all in for just $650. We'll show you what that looks like here in a second, but we also want to remind folks that, similar to Amazon, people who shop for this type of service, we're just as happy with physical therapy or a pain injection. It may be a more appropriate treatment for your underlying pain. And it comes at a fraction of the cost. It's just $10 to have a pain injection, $15 to start visiting a chiropractor. So members are turning to alternatives to surgery as an option, given it's easy and affordable. Those who are true candidates for surgery are finding high value locations and doctors to see. For instance, if you go to the Bedford Ambulatory Surgical Center on Washington Place, you'll see it's just $650. And again, members say, well, that sounds too good to be true. And we give them the clarity in advance. That's your single price and everything's included. It covers that procedure. Here's a great description of it, including the professional and the surgery itself and everything that could go along with it that day. The x-ray to make sure they're operating on the right knee, the implantable device, all included for that simple upfront price of $650. You know before you go. That's the approach. Make it clear and obvious. Make it easy to find and give people an immediate reward. They lean into that, have great outcomes in their care, and it's driving much higher satisfaction in the plan across the membership. So how does this add up? Why are folks looking at it as an option? Because it becomes a really attractive alternative. So if you have a high deductible plan today and you're hearing that it's confusing or complicated for members to use, you can add Surest as an alternative. And you'll see that it immediately lowers the cost of the plan for you, the employer, a 13% premium savings on the plan here. Moreover, it's giving members first dollar coverage, no deductible, no co-insurance. And if they were to have an expensive year of services, in this case, unrealistic, but to illustrate the point, a baby and a knee scope, they'd find under the plan, by choosing high value care, they're going to spend less than $1,500. This is an experience that if they had chosen the high deductible option, would have immediately cost them $4,000 for just the baby. Members can shop the plan during open enrollment, see the better benefits, the savings, and are jumping in spades. It's a plan that continues to protect them throughout the year. Less than 1% of members, because of the first dollar coverage, less than 1% of the members hit their out-of-pocket max. And we're finding employers taking advantage of that richness in the plan by oftentimes offering a slightly higher out-of-pocket max with the Surest plan. You can work with your advisors, with the team at United, to design a strategy to fit your population and your existing options. Our confidence in the ability for this plan to perform, our confidence in this quote, comes from years of national experience. Many outside of United Healthcare have analyzed the results of the plan and come to the same conclusion. It's working. It's working really well. One of those folks is the team over at Aon, one of the national advisors for large employers. They've done some extensive work to analyze the Surest results compared to their otherwise book of business. What they found, what they published was significant. And here's 3 notable takeaways. As you can see, this is very much, for one, a rigorous study. We looked at, or I should say the team at Aon looked at the plan's performance in the full years of 2021 and 2022, using benchmarks that they reference for like studies across the country. Many of those come up a bit short. So only about 30% of similar studies actually get published. And amongst those, Surest is shown to have some of the more significant results. The headline of which is it's saving employers money. It's bringing down the cost of claims by 5 to 10%. In 21 and 22, across the middle, average was 7.5%. But when you dig into different demographics within the membership, different age bands, when you look at members who are managing a range of conditions, diabetes, asthma, hypertension. Either way you slice it, you're consistently seeing 5 to 10% returns or lower cost within each of those cohorts. There isn't a corner of the membership. There isn't a person that Surest can't help. There isn't a place where we can't start to take some cost out of the system. It's really compelling, all while offering better benefits. Better benefits means care is more affordable. Care being more affordable means people save money. Whether they're managing an everyday condition or a complex set of what we call comorbidities, high blood pressure and diabetes, if you will. We're seeing in every cohort an ability for the member to spend less during the plan year when they go to the health system. All happening because members are avoiding the harsh reality that there are real potholes in every carrier's network. There are places that just do too much, don't do things well, or charge too much. 90% of members are going to high value locations, better treatments, better locations, better doctors. They're doing so because they know before they go. And along the way, they're having a great outcome and they're saving money. At the end of the year, the members love Surest and they tell other people about it. 9 out of 10 members renew from year to year when offered the plan. When we survey the membership, 8 out of 10 say they'd be disappointed if Surest were no longer an option. The findings have been significant and the work is super compelling. We'd encourage you to dig in and share this report from Aon with your team. It's a compelling way to start to share the Surest story. So that's the plan. That's how it works. That's what it feels like to be in the driver's seat. And of course, as we've just captured, the results are super compelling. But I want, before we close, to take a step back. Because for all of us here at United Healthcare, this is personal. We're aiming to help members get better outcomes. How do we help people get better care? Surest has been one small step for the insurance industry at large and one big step for our members. Carter is a part of the Surest family. As a toddler, Carter, his parents found, was a bit slower to advance through the key milestones that they'd seen his older brothers walk through. Had trouble talking, if you will. But in the moment, his parents thought, like many of us do, kids grow out of it. But a few years down the road, Carter was still stuck. So his parents found a local speech therapist. One they had heard advertised on the radio, read some Google reviews, had good scores, and they took him to the speech therapist to see if they could find a way to help Carter come along a little faster. A year into the therapy, his parents were offered Surest as an option by their employer, and they jumped in the plan. They took it home, and the first thing they looked for was the cost of that speech therapist. And what they found was a little surprising. The copay for the therapist would be a bit higher than what they were paying today. So they looked at the other options and they considered high value care from alternative therapists. And before they made the call on next steps, they looked at each other and said, it looks pretty obvious there's other options. And what do we have to lose? It's been a year, and if we're honest, Carter hasn't gotten much better. And then progress started to happen. With the support of his new provider, Carter started to untangle the real problems behind his issues. He had a physical tongue tie. Therapy was never going to resolve his underlying issue. He had to have a surgery. With the newfound confidence and better speech, he was ready to catch up at school. Got enrolled with support specialists in kindergarten and middle school and through elementary school. And in the process, we started to understand more about Carter and that he needed a little help getting up this curve on his occupational needs. So I started seeing an occupational therapist. A few more years in, he was fully caught up at school. Moving to junior high, they make sure that they've got every kid pegged for the right courses. And it was that time that he stood apart. He was selected to join the top of his class in the gifted and talented program. All starts from very small change. Surest is easy, a 2-minute decision. He's not getting any better. Let's try something different. That changed Carter's trajectory. And you know what? It was a solution that was much more affordable than the old way of doing things, the old low value care. Families like Carter, families like Carter's family, who are facing similar challenges with someone in the household, you know, they can feel stuck because what they see is an expensive path forward to resolve something that, well, maybe the kid will grow out of it. And it's at that moment that Surest helps families make a small change to really change the trajectory of their life. Surest changed the conversation and makes these big outcomes within reach. It's personal, and we love hearing about these stories. Hopefully this has been a compelling session for you today. I'm sure it stirred a lot of questions, and Caitlin and I are here to answer those.
Thank you, Bill, and thank you, Caitlin. Great presentation. And so let's dive into questions. We do have some questions from the audience, and some of the first ones that came in had to do with what kind of company can offer Surest. What's the fit and the various parameters that might be related to that, whether if they wanted to offer it as a dual option or a copay plan. Is there a limit to the size of the company, or must the company be a certain size to do that?
Sure, that's a great question. So in New Hampshire, we can offer Surest both fully insured and self-funded. So regardless of your funding type, Surest is an option. It's available for employers with 51 or more employees, so in the large group market. And it can be offered as a dual option 100 plus. And as of 1/1, you'll also be able to offer that as a dual option in the 51 to 99 space. So very flexible.
And that's a change, you said January 1st?
For 51 to 99 groups, yes. So currently we require that you be full replace in the 51 to 99 space, but as of January 1st, you can offer that as an option just like you can for 100 plus customers.
Okay. And so the next question that we had here was, are there parts of the program that reward wellness and preventative medicine, alternative medicine? How is it sort of working to get people to make behavioral changes?
Sure. Bill, do you want to take that one?
Yeah, I think one of the most compelling results we've seen is an increase in the utilization of primary care. Having a doctor in the family really starts to make a difference for our members. We know that today, all too often, people rely on an urgent care visit once a year as their pseudo PCP, or having a challenge finding a PCP that can see them within a week or so leads them to run to the emergency room or other options. When we show you that Surest can give you a really affordable copay for a local provider, and you can establish a PCP if you may have not in the past, we're really starting to change the landscape. And then in our options, we're always promoting alternatives to major procedures. So we're seeing a higher use of physical therapy, higher use of chiropractic care. We believe fundamentally that wellness, overall health starts with engaging in your decision. And we know today that the biggest deterrent of engagement is cost. It's a deductible, frankly. It's a $2,000 hurdle that sits in front of every member that's really dampering their engagement with the plan or all wellness initiatives. When we pull down that barrier, we're starting to see real results.
Related question to that occurs to me, or Caitlin, early in your slides, you had a reference to, the unaddressed social determinants of health, which impact 54% of health outcomes. How does this plan potentially help mitigate that problem?
Yeah, that's a great question, Ernesto. And it's one of my favorite things about this plan. So let's say you take a family that's earning a family of four earning $100,000 or $150,000 a year, right? And you give them a $5,000 deductible or even a $3,000 deductible. That means the first $3,000 or $5,000 in healthcare expenses have to be paid 100% out of pocket by them. Those are significant dollars that in many cases cause people to avoid care because they can't afford it, or they're worried, if I go to my physical, which might be covered at 100%, is the doctor then going to order blood work or find something wrong with me and I'm going to have to go for a test and pay? And so if you think about people in those situations, they're probably not getting the care that they need. In many cases, your zip code in this country determines your health outcomes in a bigger way than your DNA code. And that's frightening and wrong, right? Frankly, it's wrong. So Surest allows us to put that power back into people's hands, give them the surety right up front about what they're going to pay and when they're going to pay it, and go in with eyes wide open without the risk of a surprise bill or an unexpected medical expense that they are concerned their family can't sustain.
So your the example you gave there, they might be concerned about going to their free or their covered primary care checkup because they might find something and ask them to get another procedure. Is a use case, Bill, you were describing sort of the way people are using the app or the system, and you showed how you search. Would people actually be taking out their phone and doing that in their doctor's office? If I'm having my checkup and my doctor says, I think you should have this. And I'm like, well, I want to know how much it is before I decide if I want to have this. Is that something that people would actually be doing?
Yeah, that's something that we've been asking people to do for 20 years. When it comes to wellness and engagement, employers have been trying to preach about this. What we're finding, though, is that we see very little participation. Members, for one reason or another, fail to do so. So what's been really a game changer with Surest is right up front, we tell you why. You're going to save some money. And when you tell people, particularly in this economy, hey, you can save $500 a year if you give us a call or open up the app, they remember to open it up more often. And they find when they do, they can have a more effective conversation with their provider. They also find that providers who are not welcoming to the conversation may be ones that they want to move along from. And there certainly is, unfortunately, that side of healthcare. We've all sort of run into those providers. So we're helping them, make small changes, remember when to do it and why. That's adding up to big outcomes over the course of years with Surest.
And I think the other piece of that, Ernesto, is the episodic copay. So when you go in for a service, it's that full service that's covered under that copay rather than each little itty bitty piece. So if you're in for a surgery, right? And let's say, you have a child who goes in for ear tubes and you pay for the surgery and you think you're done, but then you get the bill from the anesthesiologist and then you get the bill from the facility and then you get the bill from the doctor. And you're thinking to yourself, I already paid this. Why do I have to pay all of these different pieces? And so that episodic copay covering the full event I think is what really differentiates this. It's not just a copay, but it's a copay that's all inclusive of all of those pieces that the member shouldn't have to think through.
Okay. We have some more questions from the audience.
Okay.
Does this plan offer an HSA option?
No. So by nature, the IRS requires that HSA plans have a minimum deductible. And because these plans don't have deductibles, they don't meet IRS guidelines to provide an HSA. And that's really where the dual option comes into play, because certainly there are employers who have invested in an HSA strategy, and that's still the that's still the right approach in many cases. HSAs provide a wealth of tax benefits. And so if you have people who've been in that plan and maybe are using those plans as a tax deferred vehicle for retirement, healthcare expenses, that's where the dual option really comes into play, right? So being able to still offer that, but offer Surest alongside it for the people for whom an HSA might not be right.
Can you describe in a little more detail what the dual option looks like in practice for an
Sure.
employee or for an employee?
Sure. So let's say you have a plan that has a $3,000, $6,000 deductible today, right? So an individual pays $3,000, a family pays $6,000. Let's say you want to keep that plan. You have an HSA alongside that. It's an HSA eligible plan. Keep that plan and add a second option for Surest. And then when you go through open enrollment, let your employees make the choice. Do I want to stay on the existing plan or do I want to go to Surest? Let's say you offer two plans today. Add a third option. Do my employees want to go to Surest? So dual option basically just means that you can give your employees choice, like so many employers do today with, giving them a couple of different plan designs to choose from. This would be another one they could offer alongside that.
Okay. Question from the audience, is underwriting required?
Yes. Yep. So all of our large group plans are underwritten. So remember, this is 51 plus. And so, yes, underwriting would determine the rates for a specific group.
Okay. And is it available to individuals in any way, or is it only to employers?
Employers, through employers. Yep.
And is this plan creditable for Medicare purposes?
Yeah, Bill, maybe you want to answer that, but yes, I believe all the plans that we have on Surest are considered credible coverage.
Yep. There'll be a day down the road where it'll be available through the Medicare Advantage programs and individual programs. So we built the plan to scale to those markets, just not quite there yet.
Okay. So Bill, reminded of something that you said. You said sounds too good to be true as you were showing some of the incredible savings. And what I wondered is it a fit for everyone? And who are the right kind of clients or employees? What's the demographic that this is a really good fit for? And is there anybody who it's not a good fit for?
Yeah, great question. Great question. So one of the things we like in offering an additional option is that you give them your members choice. And those who elect the plan are raising their hand to say, I think this is going to be a good fit for me. And those who aren't, maybe want to see it perform a year, they're a little skeptical. They're asking, sounds too good to be true. And instead of taking the leap of faith today, I'll just wait one more year. A lot of those folks jump in year two, but there are still folks who don't. If you are not using the healthcare system at all, and you are able to accrue an HSA account because you're not pulling funds out of that, that can be a really good option for you as a younger member, if you will, to continue to build a balance there and play through with that approach. And those are the folks, I think, most often who stay in that plan and don't move over to Surest. Otherwise, we're seeing really across the board affordability be the number one reason why people are jumping in the plan. We all have seen the growth that GoodRx has had for consumers when they go to pick up their scripts. People, if you tell them, hey, you can save a little money, they ask how. If it's easy, they tend to do it. And so with Surest, we're seeing the same story play through. And it's funny, that certainly has been the case, as Caitlin mentioned, with the blue collar, if you will, population, construction workers, manufacturing employees, distribution center truckers, who have seen their incomes being eaten by their healthcare premiums and want more affordable coverage in what they have. I will tell you though, we also see just as many high income folks use it because no one likes to go to the hospital and feel like they get a surprise bill for an extra $500. That doesn't feel affordable to anyone. That's frustration. It's confusing. It's complicated. 95% of people say they'd like to know the price in advance. And as a result, this plan is working for a lot of people across all industries, all demographics, all corners of the country.
I have
And
to
I'll
say,
just-
I'm curious about who the 5% of people who don't care what the price is in advance.
Well, the employer should be concerned because as long as my employer is paying for it, I could care less is kind of the mantra in that corner. And, those are the folks we're trying to slowly chip away at.
And I'll just add one thing to that. We're often asked, like, well, what if I have an employee who doesn't want to use the app, who doesn't want to do research, who doesn't want to interact? Should they just not enroll in this? Well, no, because that same person isn't doing any of those things on an HSA plan, right? So even if they did nothing and didn't do their research, they're still on a copay-based plan where they're very likely to end up paying less just by default. So there's very few scenarios where you would compare this to a traditional plan and end up paying more, even if you're not, the ideal consumer and using it the way we want you to. Again, we hope you will because it's very easy to use. It's a simple app like we all use every day when we scroll Amazon or any other shopping platform. But even if you don't, you're still on a fixed cost plan that you don't have to worry about surprise bills on. And that's really impactful either way.
So does United Healthcare I think you mentioned that United Healthcare offers this to your employees. What's the uptake in there?
I don't know exactly what the uptake's been. It's been significant, but Bill, do you happen to know that stat?
Yeah, it has been very significant. It's a plan that's been offered for 4 years. It's a plan where everyone at United Healthcare, who's an insurance expert, had sort of that same reaction. Sounds too good to be true, and had some skepticism. But we've seen the participation, effectively double year over year. Today, it's about a third of the employees at United Healthcare, and that United Health Group actually, spans everything from insurance executives to nurses and hospitalists out to doctors. It's really one of the largest encompassing employers in the country and working for all of their membership types.
Are there other companies using it in New Hampshire now?
Yes. Yep. And it's been, we have seen that, the brokers who have leaned in on Surest have had a lot of success going out and talking to new, us helping them talk to new clients about it. So yes, it's working in New Hampshire. It's working for New Hampshire employers. And we've gotten great feedback about it here locally.
Okay. I mean, that going back to that too good to be true thing again, just so there's so much cost savings in there for both the employer and for the subscriber that, I think you can't help but wonder, okay, so how? Like when you're pointing to the service providers, you're indicating they're, high quality care. It's not a race to the cheapest service. So, but where does the savings come in? Like, how do you do the magic there?
Yeah, so that's a great question and a question that a lot of people innately ask. And it's really down to the care that you receive at those high performing providers. So if you think about, and there's a great exercise that we sometimes do, right? If you take 4 doctors and you say, let's say Bill has knee pain, and we give him the option, are you going to go to Dr. A, B, C, or D? And you give him no information. How's he going to make that decision? Well, he might ask a friend or a neighbor. He might just randomly pick off the internet who's convenient, who's closest to him, who seems to have the soonest appointment. But he has no idea what he's walking into. Let's say you give him a little bit more information and you tell him this provider costs this provider costs this provider costs this. Well, is Bill through his deductible? Does he care what they cost? Because if he's already hit his deductible, maybe it doesn't matter to him. Or maybe Bill says, you know what, the highest cost one's probably the best quality. And then let's say you give them a little bit more information and you say, these are, Dr. ABCD's surgical outcomes. Well, now maybe Bill can make a little bit of a more informed decision. But when you really peel back the onion and you think about which 4 of those providers are the best, you have to look at what our algorithm is smart enough to look at. And that's, how often does that provider go straight to surgery? How effective are they with PT or pain management? How effective are they at avoiding the surgery that could have complications? And then once you get to surgery, how effective is that provider at doing that surgery one time the right way and getting an excellent outcome so that that patient doesn't land back in the hospital with an infection or a need for a redo procedure? All of that is complex and not something that you as an individual member can easily research, right? So the algorithm is built to steer you towards those providers, that provider that's not only the most cost efficient from a, if I get to surgery, but from a quality outcome perspective of maybe I never need surgery if I just get to the right place up front. And that's the magic. So, we talk about the cost savings and that's all important. But at the end of the day, there's a member who's giving up time with their family, who's being inconvenienced, who's taking a risk by having a surgical procedure that maybe they never needed. And maybe they're not going to have an ideal outcome if we can't get to them and steer them to the right place up front.
The last thing I'll add is the status quo is actually not that great. So we don't have to do a lot to start to unlock some meaningful savings. In our work, we've found that about 1 in 3 decisions need to be made to the better for us to start delivering these savings. So it's a really low bar for an employer to clear. And when you look at the decisions within that change log, we're seeing about half of them being members choosing, as Caitlin just highlighted, better treatments. Keep your same doctor. Start with physical therapy. We're seeing a quarter of them change locations, avoiding the emergency room, keeping their same doctor, having the same treatment, but starting in that ambulatory surgical center for their procedure. And then the other last 25% are changing doctors. So there's a lot of waste. There's a lot of care that's done too much or places that charge too much, where we can really help members find the pockets of affordability and high value care. All of which, by the way, we haven't made up. This comes right from the medical associations. So every specialist in the country continues their education year to year around what type of care is considered the best pathway, what is best in class, what is evidence-based medicine is another term they use. And we simply use that as the benchmark from which we look to real data to understand where high value care is being performed.
And you said that, this is, so the status quo, not so good. And that is, I would read that as you're talking about the cost of healthcare overall and maybe even outcomes. It just, that cost keeps going up. And that's because of waste, unnecessary treatments, and a lack of transparency. So is that really kind of, could you boil that down and say that's the problem with healthcare costs right now, those things, and this is one way to address that?
The larger think tanks in the country have come to that conclusion as one of the leading factors in the cost of care. About a third of services and care is considered waste. I know, we think highly of all providers, and they've obviously gone through a ton of education, but the variability on outcomes is, no different than a contractor you hire to redo your roof. We know that some folks don't get it right the first time, and you maybe should have paid a little bit more to begin with to have the roof done right, because if you have to do it 2 times, it's going to cost more. Providers are, at the end of the day, contractors for keeping us healthy, and they're subject to the same mistakes and challenges as any other industry.
Okay. We do have one more question from the audience, just came in. Since underwriting is required, if the group does not perform well during the plan year, what sort of increases have you been seeing?
Yeah, so it's important to remember that like this it's not magic, right? So if you have a large claimant, if you have a transplant or something like that, right? That you still have that, right? That still goes into your experience and that doesn't go away, right? Hopefully we can get the transplant done at a better place, have a better outcome, but that's still going to be, a pretty big claim. So it's not going to wipe those things away. But when we look at Surest compared to our non-Surest plans, our renewals have been more favorable. Time and time again on Surest, which shows us that it's working. And Bill, I don't know if you want to speak any more specifically to that, but we've seen, great luck on renewals versus a more traditional plan.
Yeah. The other thing I think we hear from employers is simply savings, better trend is important. But at the end of the day, we want to get more for our money. And it feels like we've, over time, the last 10 years, sort of stripped the value out of the coverage. And it's nice to have a refresh to first dollar coverage. We're happy to pay for it, and our people love it. And it's helping us retain and attract talent in an ever challenging environment to do so. This isn't, another marketing exercise to try to get a better deal. Employers are adding this as a real solution to their overall hiring strategies, and it's proven to be effective doing so.
Well, I think that, a last thought maybe that you could speak to, Caitlin, is or Bill, is Caitlin, that the algorithms that you were describing have access to so much data. I don't think most of the public would be aware is even collected, like in terms of all of the data on outcomes and the surgery versus PT, what everything that every doctor is doing. How new is that? Just having the availability of that data and then having the technology to process it.
Yeah, so we at United Healthcare have a distinct advantage because, we're part of United Health Group, as is Optum. And so we have more data of this nature than anyone else. And so we're able to use it effectively to roll out plans like this. So I don't think it's completely new. We've had transparency type tools and we've collected data for a long, long time as part of our normal business practices. But I think what is new is the ability to use it in this very innovative way, to make it consumable to the consumer, right? To give them a very easy answer to a very challenging question, which is, where am I going to get the best care at the most efficient price and have to only do things once? And so the ability to bring it all together in this very unique and proprietary way is what makes Surest so special and unique in the market.
I think that's a great note to end on. We're at the top, we're at the hour. So I want to thank you, Caitlin McCormick, Vice President, Sales and Account Managing at United Healthcare, and Bill Schreiber, Account Executive at Surest. I'd like to thank our audience for being out there today and for asking a lot of great questions. And thank you to United Healthcare for sponsoring today's webinar. A recording of it will be available at nhbr.com a little bit later today. And have a wonderful day, everyone.